What's up, everybody? This is the Inspirations podcast, and today I have a wonderful guest named Helen Fosam. Helen is a freelance medical writer. She is the owner of Edge Medical Writing and the creator of Milo Initiative, and she was also the past president of the American Delaware Valley chapter. So I'm glad to have her on this platform. I find her to be very wise, and she also played a pivotal role and me becoming a freelance medical writer myself. So, Helen, can you please do us the favor of introducing yourself to the audience and providing a brief summary of who you are?
Sure, absolutely. It's a pleasure to be on, Ike. Thank you for inviting me. Yeah. And just a quick correction, I was the president of the American Medical Writers Association, Delaware Valley chapter.
Yeah.
So just to get that clear.
Sure.
So in terms of who I am, my background, as you said, I'm a freelance medical writer, but I didn't start out that way. After completing my doctorate, I went into the traditional route of doing bench work, non-clinical research, and then going into academia to teach. And then my freelance writing actually started when we relocated from the UK to the United States. And in terms of why I started medical writing, it was simply because I fell into it. It was when I was applying for jobs, it was the career path that met my background. So essentially, I didn't know about medical writing. Mm-hmm. My resume brought me into medical writing. Yeah. But that was almost 20 years ago, and I haven't looked back.
Wow.
And so as far as where I am now, that trajectory, I'm still on that path of medical writing. As you said, yes, I'm now focused on, or more focused on the Milo Initiative, which I'm sure we're going to talk about later.
Sure.
But in terms of the medical writing aspect of it, it is almost, I would say, it's a continuation of that journey as a medical writer. Initially employed as a medical writer, and then subsequently a freelance medical writer.
Yeah. So let's dive deeper into that in terms of medical writing. Can you speak more in depth about how you became employed into the medical writing field and how you were introduced into it, Helen? And then also, what inspired you to make the leap from being an employed in medical writing to freelancing? Can you speak towards both of those?
Yeah, sure. So in terms of how I actually got into freelance, right? Not freelance, into medical writing.
Yeah.
Or who introduced me to it? I'll have to say my resume introduced me to medical writing. As I say, in the UK at that time, medical writing wasn't really that well known. There were aspects of medical writing, for example, the company I worked with in the UK at the time, my role was to help physicians publish their work. So they do research, and then my role was to help them publish. So it was a form of medical writing, but it wasn't called medical writing. So when I relocated with my family to the United States, of course, I started applying for jobs.
Yep.
I filled out my resume, and or the searches I was doing according to my background, medical writing kept coming up, and I just thought, what is this?
Yeah.
Medical writing. And to be honest, I ignored quite a number of them because I had no idea what it was. But eventually, long story short, I was employed by somebody to do that very, medical writing, and actually, it resonated very much with the background that I had in terms of, the roles I was doing back in the UK.
Mm-hmm.
So in terms of, how I got into it, I'll say, that's essentially surely by accident.
Yeah.
Surely, my resume brought me into medical writing. Mm-hmm. As a freelancer, so I started medical writing as an employee.
Yeah.
I did that for approximately 9-10 years.
Okay.
And then I lost my job.
Oh, okay.
Freelancing. Again, I fell into it purely by accident.
Oh, wow.
And this is how it happened. My former boss in the company that I used to work for, almost a day or maybe a day and a half after I lost my job, reached out to me and said, well, Helen, can you help us with the project? We have a tight deadline. And
Wow.
by the way, I was unemployed. I said, oh, let me check my calendar. Let me see if I have any availability. And that's how I started. I started with this company and as a freelancer, helping them meet their deadlines. And the great thing was that the person who brought me in used to be my former boss.
Oh, wow.
So I knew that person and that person knew me. And they knew the type of work that I do, the quality of the work that I do. And this is what I advise every person who wants to, move into the field of freelance medical writing. Never burn bridges. Never, always, when you leave a company, always leave on a good note. Whenever you are working with members of your team or even clients as an employee, always, do your best work because you don't know when the payback will come. I say because all the clients that I've had as a freelance medical writer have come from either repeat business, recommendations from people I've worked with, or just, simply, people seeking me out, knowing the quality of the work, the kind of person that I am, and the fact that I did not burn those bridges. I treated everybody with respect. The clients that I've had, one after the other, has always been, people who I've worked with in the past or people who have recommended me based on what they know of me. So as a freelance medical writer, repeat business sustains you. Giving more than is asked for, ensures that your callback. I always say that the client is always right.
Yeah.
So if it means revision the 10th time, do that revision the 10th time. It doesn't hurt.
Yeah.
You might take a bit more of your time, but the rewards will come later. I don't know if that answers your question.
No, you answered my question great and very elaborately. I appreciate that. So hearing you, it sounds like medical writing found you. You didn't find medical writing, and your resume played a big role into that, which is interesting to hear because I feel like nowadays when I speak to other freelancers or medical writers, it's that people are looking out from in or trying to get in, but you are blessed to have the opportunity presented to you, which is awesome and great to hear. I'm curious to just kind of learn more in depth about the transition into freelancing and what has that been like for you. What are some of the differences that you've noticed freelancing versus being employed for a medical writing agent job?
Sure. Now, before I answer that question, I'll go back a step.
Sure.
In terms of freelancing finding me, and people these days are looking to see how they can enter.
Yes.
You have to keep in mind that there's a 20-year gap. When I started, medical writing, per se, wasn't that well known. It was a very small industry.
Yes.
Now, things have changed since then. The number of research is being done by pharma companies, especially after COVID, during and post-COVID.
Yes.
It just has exploded. More and more, there's more regulatory agencies, there's more, just people needing content that's medically related. So when I started, it wasn't like that. Keep in mind that I did not know what medical writing truly was until I fell into it. Mm-hmm. So I think that's the key difference. It's just a difference of time and demand. And I'm sure if I was entering the field of medical writing today, I would also be wanting to seek out opportunities rather than opportunities trying to seek me out.
Yeah.
So
yeah.
That's the key difference.
Yeah.
Okay. Now, in terms of what the difference is between me as a freelance medical writer and being an employee, again, I always say that as a freelance medical writer, this is where my heart belongs, because I don't know, people are different, but for me personally, as a freelancer, the opportunities are just, I don't want to say limitless, but you are essentially in charge of how much you do, what you do, who you work with. Yeah, you can even fire clients if you want to.
Yeah.
And you can do that as an employee.
Yeah.
You can, determine how much you work, how long you work for. It's so flexible in terms of the type of work you do. It's so varied. So my personality, it fits me perfectly because I like variety. I like to learn as much as I can in different therapeutic areas. And freelancing allows me to do that. It allows me to work with across the board, whether I want to work with the pharma companies, doing manuscript typewriting, working at the patient level, content, working with medical education companies for physician education, promotional. So the flexibility as a freelancer, I really can't compare it to an employee, because not that being employed is a bad thing. It's absolutely a wonderful thing. And I can speak to why if you want me to.
Sure.
But as a freelancer, I wouldn't, my preference would not be to go back as an employee unless I absolutely have to, because I'm just spoiled. I'm spoiled as a freelancer. I get to do what I want to do, within limits, of course, because you're still almost an employee, because when you have a client, you're working with that client almost as an employee.
Yeah.
Because you have to satisfy their needs. They tell you what they want and you have to deliver.
Yeah. One of the beauties of freelancing is the abundance of opportunities and how, like you said, the variety. I'm with you too. That's one of the reasons why I gravitated towards freelancing, because I like the ability to learn different things and experience different things. So, talking about experiences and meeting new people, Helen, I'm kind of curious, what are some of the experiences that you've been able to get and the type of people you've been able to meet as a result of freelancing? I feel like freelancing allows you to, like you mentioned, you work with agencies, you work with health brands, you probably had an opportunity to make a lot more connections. Can you kind of describe or tell any stories of unique experiences you've been able to create as a result of freelancing?
Sure, I'm not quite sure which one to share, but in terms of the opportunities, as a freelancer, you go directly to the boss. You go to the decision makers. You get to speak to, to work directly with, maybe the CEOs or the VPs of, companies. You get to, on a first name basis. So you actually, it exposes you to opportunities and interactions, connections that you might not be able to get as an employee. Because as an employee, for you to get to that level of interaction, depending on where you are on the totem pole as an employee, you're kind of far removed from the decision makers. usually.
Yeah.
At least I was when I was an employee. But as a freelance writer, you need to work directly with, those decision makers.
Yeah.
And in terms of a specific example, the one that comes to mind is when I worked with Harvard Medical School.
Oh, wow.
They were looking for someone to write a paper based on I guess what they had done with a group of other experts. So I was called on to be the writer for that. I worked with the whole team, from people in the people who contracted with me at Harvard, with all the other team members who are not necessarily at Harvard. So international. They were everywhere.
Wow. Yeah.
Where would I get that kind of exposure?
Yes. Yeah.
To work with such an iconic, reputable institution.
Yeah.
Work with people that experts in the field that I would never otherwise have worked with.
Yeah.
So this is just one example of the opportunities that presents itself as a freelancer. And of course, when you work with these people, you appreciate that they are just like you, and that they are people that you can have a conversation with.
Yeah.
On a very basic level, on a friendly level. And it just makes you realize that they are not these people in ivory towers where there's a glass wall between you. No.
Yeah.
These are real human beings that are warm and kind and friendly, and just need your help to execute a project that they're working on. So that was a really great experience that I had.
Yeah. One of the things that I've learned from freelancing is exactly what you said. Before you get into it, you're kind of thinking that they're super powerful, or like they might have this corporate feeling because that's where you came from. But once you start to actually speak to them, they're just people who are looking for needs fulfilled, just like any business or service. And if you can fulfill that need and do it in a timely, fashionable manner, you did a great job, and they'll probably want to keep working with you. So, it's interesting to hear that, and I didn't know you worked for Harvard Medical School, but that's really cool. I'm curious to learn, Helen, when you made that transition into freelancing. I know you weren't really super intentional about it because at first because your boss introduced you into it, but then you chose to keep at it. Once you kept at it, was there any fear of anxiety or depression or any type of negative feelings that or of uncertainty that made you doubt your path? And the reason I'm asking that is because just in general, in entrepreneurship, or whenever people are making a transition from a 9-to-5 to a freelancing gig, you move away from that stability. And I know for a lot of people that can be scary. So I was curious if you ever had that doubt for yourself.
Totally. Absolutely. I don't think there's any living, breathing human being that don't have that kind of anxiety. Especially freelance writing is called boom or bust. For some, there's more bust than boom.
Yeah.
It's cyclical.
Yeah.
There's no time where everything is perfect.
Yes.
Or guaranteed. No. And that's, I guess I touched on, speaking about the benefits of being an employee is that regular paycheck. As long as you do your job and you do it well, you won't be fired. You'll get your paycheck. In freelancing, it's not like that. You are your own boss.
Yeah.
You are responsible to get your business, to attract your clients.
Yeah.
You are responsible to do your taxes, your everything related to a small business, because that's who you are. That's what you do. It's all on you.
Yep.
And if the revenue doesn't come in, depending on your situation, then it's a problem. And that's why I started off saying that repeat business sustains you as a freelance medical writer.
Mm-hmm.
Doing good business, give it 110% or more, keeps you in business.
Yeah.
Your client always being right keeps you in business. Now, because there's more competition, definitely more competition, as a freelance medical writer, it makes it even more important for you to give more than is asked. Now, I know that some these days would promote themselves in one way or the other, maybe social media, maybe advertising. All those are important. But in terms of that anxiety, whether or not you're going to meet your goals, whether you're going to keep your clients, and sometimes it's not because you haven't done good work. Maybe it's because the client that you're working for or you're writing for, that their client who you're writing on behalf of have stopped that project that they're doing. Maybe it's a pharma company. Perhaps it's a new drug that they're working on. Maybe it's been pulled off the market, or maybe the phase 3 or phase 2 clinical study it hasn't worked out and it has to be terminated. So sometimes it's not really your fault. It's not your fault. It's just the circumstances. But that anxiety that you asked about, it's always there with everybody. As just like any small business. You gotta make the money. You got to sell yourself. And that's something that I learned as well, because as an employee, medical writer, knowing that as long as I do my job, I'm going to get paid. It wasn't for me to then promote my skills in terms of my speaking skills, my being able to go out and hustle and ask and promote yourself. This is something that we learn as a freelance medical writer, because it's on you, it's on me to go and sell myself. I didn't have to sell myself as an employee. Once I sold myself at the interview to get the job, that was it. And maybe there are little trainings that you do along the way for the company. But in terms of building your skill set, building you as a person, in terms of that growth, it becomes on you. And that's why it's always a great idea to seek out training programs that are available, free ones, of course. You don't have to always pay for those, unless you feel that you have the resources to pay. But personal development is so important, because this is how you can promote yourself. How you need to go out and convince people that you can do the job.
You definitely gave a lot of gems and wisdom. One of the key differences that you mentioned that I would like to note on is, like, when you're an employee, you no longer have the issue of needing to sell yourself. You're part of the company. You don't have to really convince anyone to hire you again. Whereas a freelancer, you have a bunch of multiple clients, and you have to kind of learn how to promote yourself and sell yourself. So my question to you is, as now that you are a freelancer and you're doing that for a living, what have you learned about marketing and selling yourself? Because those are skill sets that freelancers who probably came from the employee field now have to learn in order to get clients. So I'm just curious to learn about some marketing strategies you may use every once and then for yourself, or some stuff you do to learn about selling yourself and convincing other people to trust you to give them their business.
Yes. So selling yourself, it's really about it's showing rather than telling. It's being, when you speak to a potential client, is being your authentic self. There's nothing worse than coming across as too desperate or over eager. It's just being you. Now, when I say it's more about showing rather than telling, the quality of your work speaks for itself. When you are looking for a new client and they ask you to, send in samples of your work, what you send in reflects the kind of work that you do, the quality of your work. Or when they ask for references and they follow up on those references, and your prior clients will speak about you and their experience working with you, that in itself is promoting, who you are and how you work. So in terms of how I market myself, as I say, in the past, in all the years I've been a freelance medical writer, it has been repeat business. The only time that I will say I perhaps I marketed myself was right at the beginning, where I would, do my research of medical communication companies, send out a whole, bunch of letters and material. But beyond that, it has always been, client number one would change jobs. So I'm working with the first client. The client will then move on to another job. The second job that they moved on to, I become their client. So I've now acquired 2 clients.
Oh, wow.
I did that for one person. And out of that, I had 5 different new clients because they job hopped 5 times. Because each time this person moved, they'll bring me on to the business. Plus the other ones I've been working with.
Wow.
So in terms of that promotion, I wouldn't say that these days it's different, I know, because there's more competition. But that aside, I think if you do the best work that you can do, and that's why I say your client is always right. Okay? No matter what, don't argue, just do what they ask you to do. Just being when you're talking, if you can do something, be honest and say you can do something. If you need to ask for clarification on a project, or even when you're seeking to work with them, ask those questions. Asking questions is so important because it cuts down all the mistakes that you're going to do. Yeah, it gives satisfaction to the people that you're working with. They may see it as annoying. Oh my gosh, another question. When I have a new client, the first thing I do is fire them with a series of questions, because not necessarily, so disturbing by phone call. I just put them all in an email. Yeah, this is what I'm thinking. Does this resonate with what you're thinking? Is it what you want? Do you have a template that you'd like me to work with? Do you have a sample that, because every client is different.
Yes.
So in terms of, how I promote myself, it's really promotion based on the quality of the work that I do. Because that is what speaks. It's not what you say.
Yeah, it's what you show. Yeah.
Especially in medical writing. You can't just talk about.
Yeah.
You can't talk about a client's solution. You have to deliver a client's, solution. And it's in writing. So it's the quality of the work that you do that counts.
Interesting. Yeah, so you would say your greatest form of marketing, it's not necessarily marketing itself, but the work you do, because it shows how great of a freelancer you are and a medical writer. That's great to hear. Yeah, they say good business is doing good work with good people, and so if you do good work, I think that's why you're so blessed to have such repeating business. So I want to transition and talk about the Milo Initiative. You and I have talked about that, and I had the pleasure of writing a few articles for you in the past. Can you talk about what the Milo Initiative is and why it's so important for you?
Yes, be careful, you never ask.
Yeah.
Yes, the Milo Initiative it's spelled MILHO, and it stands for the Missing Link to Improved Health Outcomes. Again, this is something that I fell into purely by accident. This is how it happened. I had someone emailed me who was based in Nigeria, asking me to help them put together a medical, like a conference, a medical conference for continuing medical education, CME. And I asked I asked them all the series of questions, and one of them was, what's your timeline? They told me 1 month. I said, no, you can't put together a program by that in 1 month. The lead time is typically 3 months. So I gave them all the information and said, okay, good luck. And if you need further help, let me know, but I can't deliver in 3 months. And that's again, being honest and authentic. What you can't do, you can't do.
Yeah.
And a few months later, they come back to me and said, okay, we now don't want to do just a one-off conference. We want to do a whole program, a whole continuing medical education program. And that's when I started thinking, okay, why is that the case? Why? And they explained that in Nigeria, they don't really have, a lot of opportunity. Doctors don't have a lot of opportunities for CME programs. Not that it doesn't exist, but depending on where you work, especially say in a village setting, it doesn't exist. Or if it exists, they have to pay out of pocket. So many people can't afford it. And the consequence of that is that, patients don't get the optimal care that they need. I usually say, once you're a doctor for life, and you're a doctor of everything. But that's not the way it should be. So after that interaction, I went back and reflected. And long story short, I just decided that there's a problem that needs to be solved. Okay. I did more research, and all the research that I did, not just in Nigeria, across Africa, was the same story. Patients are not getting optimal care because of lack of access that healthcare professionals have to update their knowledge. So I went back and I thought, okay, I need to try and solve this problem. What would it be? So I thought long and hard, and Milo came about. And the whole premise of Milo is to create online medical education content for healthcare professionals, specifically in Africa. Now, when I started this, somebody asked me, "Oh, can't you just go to Medscape or all these other? I don't want to I should say names, but can't you go to platforms that already exist, say in the United States or in Europe?"
Yeah.
But the truth of the matter is that some of those contents are absolutely brilliant, but they're not always relevant. Because, for example, if a CME program on, say, diabetes is published for the American physicians, and they talk about the latest and the greatest, biologics that don't exist in Africa, or they talk about, hypertension or stroke, that is caused by, in the majority of strokes in the States is, or should I say the majority of strokes in Africa is the hemorrhagic stroke, which is not the case here in the States. So some of the content are not always relevant. And the type of, beliefs and culture that comes in, cultural beliefs that comes into how healthcare is accessed and delivered is different. So while the content here in the States and in Europe are absolutely brilliant, it's not always relevant to the African population. So with Milo, what we do is create this content using professionals in Africa who understand the situation, who understand the true need of the people in Africa, because genetics comes into play, cultural beliefs come into play, access to care comes into play. Yeah. Even, the type of, medications are available come into play.
Mm-hmm.
So with Milo, it's really about creating those content that resonate truly and relevant to those people who need it. Created by people there. That's why I used you to write my content.
Yes, yes.
And that's why I use professors in Africa to write the content. One case in point was a program on reproductive health that we created with a professor in Zambia.
Yeah.
The draft was sent to him, and he read through it. Now, when I wrote that draft, with a combination of other people, I based it on the resources that are available here in the United States.
Mm-hmm.
His comment was, "This is brilliant, Helen, but none of this applies to us. It's not, we don't have this, we don't have that. This is what we do, not that."
Yeah.
So it's important to use, experts, from writers, reviewers, subject matter, so experts on the topic, depending on what the topic is, people who are knowledgeable. I always say, they know where the shoe hurts.
Mm-hmm.
Okay? So, and that's what that's what Milo is about.
Yes.
Now that's for the healthcare professionals. More recently, we've been focusing on the patients, using, creating patient pamphlets, because the same problem exists, especially in the African setting where beliefs, come into play.
For sure.
As to how a disease is believed and managed.
Mm-hmm.
And also there's the issue of language.
Mm-hmm.
So we don't only create those content that will resonate with the patients in Africa, maybe the general public in Africa, but also to translate it so that they understand.
Mm.
And, using graphics so that it's relevant to all learners, learning types. Mm-hmm. And the idea is that doctors can use these pamphlets to explain the conditions that a particular patient may be suffering from, letting them know that, no, it's not caused by, somebody on the other side of the wall, or your ancestors are doing whatever they want to do to make you this sick. It's because this is a true, medical condition, and this is how you can stop it. You can help treat it, and this is what you need to do to avoid it.
Mm-hmm. Mm-hmm.
So with Milo, overall, in a nutshell, it has three arms. The first arm is physician education that's relevant. The second one is patient, education. Okay. And the third is capacity building, because ultimately, my goal for Milo is to have a team that is responsible for creating all this content. And that team are sourced from Africa, because the talent in Africa is absolutely incredible. From the medical writers, and like yourself.
Yes, thank you.
Yeah, to the graphic designers, the subject matter experts who understand what the need is, and who would be given, that opportunity to showcase, their talent, and earn a living as a result. So Milo is really about creating these resources and using it to create employment, capacity build, use the expertise and the talent that exists.
Yeah, so I'm curious to just learn more about the healthcare issues that Africa is currently facing, and that you have noticed as a part of being a part of the Milo Initiative. In the U.S., we're very familiar with the issues that burden us. I was born in Nigeria, and I went to Nigeria for vacation, but I don't live there, and I can't speak too much in depth about the current problems in the healthcare field that Africans are facing. I imagine you have a lot of experience and knowledge in that area. Can you speak more towards what are some of the issues that are prevalent in the African healthcare system?
In terms of the issues, in terms of
just like issues like in regards to like maybe like cost, disease management, access to hospitals, like that.
Yeah. No, absolutely. I guess because healthcare in Africa is usually out of pocket.
Yeah.
I know that in some countries that there are health insurance being established, but how many people can actually afford it? When I talk about Milo, I talk about not those in ivory towers, not those who are registrars in or hold high position in hospitals. I'm talking about the foot soldiers, and by that I mean those doctors and nurses and pharmacists and who are in the village setting, who see patients, who really are interacting with patients. Because in Africa there's one doctor to 5,000 people.
Oh wow.
One doctor.
Oh wow. Wow.
It's not my statistics, it's published.
Wow.
And in some, that's an average. So in some, there's even more. So when you have that kind of statistic, and if you imagine what that one doctor in a village setting, with patients that span the spectrum from newborns to the older people, maybe more than 70, with different disease states along the way.
Yeah.
How do you expect that one doctor to know everything?
Yeah.
So that's a problem. All right. Now, access to care is also a problem, because not everybody can get to the hospital when they need to get to the hospital. Okay. Not everybody has the means financially to get to get the care they need when they need to get the care. Milo is not. There's too many challenges for Milo to solve. But the problem that Milo is trying to solve is that knowledge. Because imagine that one doctor in the village or in the community setting who needs to know what the problem with the newborn is or the under fives, and then transition. The next patient is perhaps a teenager with either STD or whatever it is, and then you move on to somebody who is older. Okay, their problem now is hypertension, diabetes, whatever it is. If they don't have that updated knowledge, it can be dangerous, because imagine maybe a drug has been pulled off the market and been using since they graduated from medical school. And it turns out that this drug should not be used anymore, or the dosage should be adjusted, or it should, or whatever, or the combination has changed. If they don't know that, then they're not doing a patient, any service. In fact, they may be killing the patient. So the idea of Milo is not to solve all the healthcare issues. There's too many to solve, but let's just start with this little one. And also for the patient themselves, let me understand what's causing my sickness. Not only what's causing, how can I stop it? Because there's nothing worse than having to treat a disease when you can actually avoid having that disease. If you're pre-diabetic, let's change course so that you don't have to become a full diabetic. Mm-hmm. I know that's not the case for every disease. But there are also others. And this is one story that I actually tell in one of the, updating the website for Milo. One of the stories I've told is one of Peter. Okay. Peter is a 9-year-old boy who is epileptic. He has seizures. But his parents thought that those seizures were a punishment from the forefathers. So every time he has a seizure, he's just left. So say, the parents are saying, okay, after a while, the devils will leave and he'll be okay, which is the case. Most people recover from the seizure, all by themselves, right? But this boy, just after he turned 10 years old, he had a seizure and he died. Oh, wow. Imagine if the parent had the knowledge that epilepsy, yes, it's a seizure, but you can actually manage it. You can go to the doctor. Yeah, you can be told how to look after your child or your whoever it is while they're having a seizure. Yeah. So it's things like that. I think Milo is more focused on the knowledge of prevention. Mm-hmm. Or if you have a condition, Milo wants you to understand what that condition is and how you can treat it. So in terms of the challenge of healthcare in Africa, I think there's a lot of challenges, mm-hmm. absolutely a lot of challenges. And Milo is not, I wish Milo could solve all those problems because, but it's like many little problems that coalesce to become,
a big problem,
a huge one. But we just want to solve this one of knowledge based on what we know how to do and how to do well. Yeah. That's the one of, sharing of knowledge and information, evidence-based knowledge.
Yeah. It's interesting that you shared that story of Peter and how that knowledge deficit ultimately led to the death of him, which is very sad to hear. As you were speaking about that story, it reminded me about some Africans I met with sickle cell disease. I know there's Africans out there who have sickle cell disease, and the cure in U.S. versus the cure in Africa is far and in between different. And the knowledge deficit seems to be even greater in Africa to what I know. I remember having an anecdote, a story where someone told me that, and it's very sad, they told me that whenever someone is going through a crisis with sickle cell, they assumed that the devil was in them, that there was a devil attack, and they would get someone to try to do an exorcism on the person with sickle cell. And as someone with sickle cell myself and who's been through that, that's incredibly scary to think that that's going to solve your issue. You know what I'm saying? And then to further the damage of that, now that person is outcasted. They're like, yes, don't hang out with him. He's a devil. Or he has something in him. So physically, he's already screwed. And then socially, no one wants to be associated with that African kid simply because of the nature of his sickle cell. So it's interesting to hear your story with Peter. And hopefully, I'm sure the Milo Initiative can help improve the knowledge deficit and issues like that, because it seems like Africans, there's a lot of education that can be valuable for us in the healthcare field.
Yes. It's not only these two stories that you shared. It's not about the sickle cell or in epilepsy in the case of Peter. It's about every single disease you can think of. It's even about reproductive infertility. It's across the board. So in terms of being able to update and educate people, and when I say this, I don't want to sound condescending in any way at all. When I say educate, all I mean is to, give exposure, to a different way of thinking, because Africa has a beautiful, deep, rich history and culture. There are beliefs that are authentic to Africa, and all those are valid. But there are also some beliefs that needs to be tweaked a little bit, especially when it comes to beliefs of things that we don't truly understand or things that we don't see. And this is where that education comes in. And that's when I say relevance is so important. Because you can't, talk about witchcraft or devils, in a healthcare program that is targeted to physicians here in the United States or in Europe or, in the richer parts of the world. But there are some cultures where you have to. Let me give you an example. When I was doing the program, CME program on stroke, and I was researching about stroke, and I came across a publication that included a questionnaire that asked doctors in Africa, what do you think the causes of stroke is? So it had, because a multiple choice. Okay. Amongst the multiple choice was witchcraft.
Oh, wow.
Guess what? 33% chose witchcraft as the cause.
Wow.
So if doctors are just, and I just want to clarify that this wasn't like a high-powered research, or this was just, maybe an observational study that happened to, end up online. So I don't want anybody to, to think that, this was a peer-reviewed, publication that, yeah. But if the doctors are thinking this way, how are the patients thinking? Yeah. So the whole idea of what we are trying to do is to provide resources that doctors or just healthcare professionals in general in Africa can use, share with their patients, so that they will speak the same language as their patient. That's why we translate, so that they can explain that, by the way, this way you're feeling, okay, the fact that, the constant urination, maybe it's a problem with, your blood sugar, that maybe let's test you and see where things are. Okay? And if we found that you are diabetic, okay, I would like you to start taking this medication because you're going to feel better. So it's a way of communicating and explaining, and hopefully, preventing a condition before it starts, and saving lives in the process.
Yeah, as we're speaking, it's pretty clear that there's a lot of knowledge deficit in Africa, and the need for healthcare education is very vital and essential. I'm just curious to hear, why do you think there's such a huge knowledge gap in Africa? Why do people tend to go to stories of witchcraft or devilish behaviors when there's medical issues? Or where do you think that knowledge gap is originated from?
It's access to knowledge. Access. Very simple as that. Just imagine you're here, you just a few buttons and you get the information. You go to your primary care doctor. I don't know about you, but for me, I go there and, there's pamphlets everywhere. And then you have your consultation, and then they give you more information. Yeah. And they follow up. And yeah. So it's that access. It's that access. We went to Kenya to do a 3-month pilot.
Oh, wow.
And during our pilot, we give pamphlets that we've created to 90, almost 100 hospitals in Kenya. And we included a survey with the pamphlets that we gave out. And one of the questions was, have you come across pamphlets for patients at your hospital or clinic? 91% said they have never seen one. Wow. We're talking about hospital directors, CEOs, registrars. Those haven't never seen it. So can you imagine, has patients ever seen something like that?
Yeah.
No. And those that did say that has seen it were usually, so the question would ask, if you've seen it, from where? So those that have seen it is usually from the World Health Organization, some from the CDC, will create pamphlets, and it's usually on specific diseases like HIV, HIV/AIDS. So depending on where the problem is, but you don't find, on other many diseases that, that plague Africa, or diseases that tend to happen at a younger age, like, hypertension is a big killer in Africa that is happening at a younger age. Things like stroke, diabetes, all those non-communicable diseases are not as covered as the infectious type diseases. Those are important too. But because, all these non-communicable diseases are increasing in prevalence, who's talking about them? Who's giving them information that they need to know? That's what Milo is trying to address.
Yeah. So if the root cause of these knowledge deficit issues is a lack of access, I want to ask you, how does Milo Initiative make themselves more accessible and easier for Africans to gain knowledge to this and access to more information? How does the initiative make themselves more easier to reach so that it can affect and help more Africans?
Yeah. So before I answer that question, just to elaborate on the why Africans think that believe in witchcraft and devils and all that kind of stuff. Yeah. I would say it's no different from what, say, the Europeans used to think centuries ago. Because, they also believed in supernatural powers for things that they don't understand.
Yes.
So it's really no different. There are certain, people have certain beliefs about things. And until you change that belief, they'll continue to believe it. Change that belief through knowledge, through education, through, whatever avenue that you think is best for that particular society. So Africa is really no different from what people elsewhere, parts of the world, believe. So that's that. But in terms of how Milo can increase, people's knowledge, it's really, Milo started off as an idea, and Milo is gaining exposure, but it takes time. And when something is new, people don't always gravitate towards it or always appreciate what it is. It's just like any new business.
Yes. Yeah.
You have to convince people that this is valuable, this is good for you, this is what you need. So this is how Milo can reach the people that he needs to reach. So what we are doing right now is revamping the website. Milo became a non-profit 501c3 registered organization, and we're currently updating the website to reflect that. After that updating, the next phase is really promotion. It's getting the word out there. I think anything new, for it to be exposed or for it to be known, it has to be promoted. It has to be exposed.
Yes.
Who need it? And it has to be targeted because the target audience for Milo is people in Africa. So in terms of that promotion, it needs to be targeted to that specific audience. And that's the next phase of what we are aiming to do. And with the hope that with all that, increase it, because everything's online. That's the beauty of Milo. Everything is accessible online. And even with the patient pamphlets, doctors, individuals, anybody can go and have access to it. And if you so wish, you can print it as pamphlets. So I think it's just really promotion and getting people to be aware of the resources that are available.
Yeah, and hopefully one day you can continue to build out a valuable team who can assist you with creating that content and doing a lot more marketing and promotion to overall increase the brand awareness of the initiative. Because I think the work that you're doing is incredibly valuable, and I can see it being very helpful for a lot of Africans. I really do. I think knowledge is power, and the more we know, the more we can better take care of ourselves. And I think what you're doing is very honorable, and I really hope that one day Milo becomes a lot more established and fruitful, so that we can see the fruit of all the great work you're doing.
Yeah, that's my hope too. And the tagline for Milo is "Knowledge is the best health."
So, the best health.
Because without knowledge, everything revolves around having the knowledge to know what the problem is, having the knowledge to cure the problem, having the knowledge to prevent the problem.
Yes.
So knowledge is the best health.
Yes.
And it's not just for Africa, it's across
everything.
For everybody.
Yeah, that's a universal thing. I agree. Yeah.
Totally universal. Yes.
Yeah.
Yes, I mean, I agree with you. My dream for Milo is to have a team. We have a small team right now.
Okay.
It's still very much in its infancy. But my goal as a nonprofit is really to build out that team, to use the incredible talent that is there in Africa, from medical writers to subject matter experts, graphic designers. It's just incredible. Yeah. And also, they are right there, seeing the problem that we are trying to solve.
Yeah. And I hope one day that dream comes into fruition. I know on LinkedIn, you do a great job of posting and building that awareness over there. If people want to learn more about the Milo Initiative and you, Helen, how can people access the website and gain more information to Milo and just you as a medical writer?
Sure. So as you say, I'm on LinkedIn. Helen Fosam. You can also go to the website milo.net, and that's a nonprofit, but part of the Milo. That's the education arm of Milo. But we are creating the nonprofit website, Milo Inc. It's not quite ready. It's not live yet, but when it is, I will definitely start promoting that on LinkedIn. Doing more YouTube type videos, more stories from Africa. We are collecting stories. And actually, if I can do a plug on this, if anybody is interested in, sharing the healthcare, story, either as a healthcare professional on any disease, especially maybe some of the challenges they've encountered,
for sure,
or even positive outcomes that they've encountered. These are all stories that we can use to highlight the need and the successes of some of these challenges that we face in Africa.
Yeah, I can vouch for that. I wrote my story with sickle cell disease for Helen, and I'm actually grateful that she allowed me to create the content for your platform, because it allowed me to actually jumpstart my freelance medical writing career and give me content to promote myself. So I was grateful for that. I didn't know that you had a YouTube channel. Do you have a YouTube? And if so, what's it called? Yeah.
Well, actually, the YouTube that I have is I use it to as a place to store videos that I'm going to use on my website.
Oh, okay.
There'll be a time when there will be a proper
Public.
YouTube channel where it's open to the public. Right now, it's more of a repository for all the material that I want to create. So it's not where it should be yet.
Yeah.
But hopefully it will be.
Okay.
Especially when the Milo Inc. Website is up and running, because that's where I really need to start, showcasing some of those stories. Like, for example, the story of Peter is it's just it's an incredible story. Because it kind of encapsulates everything about the challenges, the knowledge challenges that unfortunately resulted in the death of a little boy.
Yes,
that need not have happened, and multiply that sevenfold over across all the diseases that we have in Africa. The numbers are just outstanding. It's just it's heartbreaking.
Yeah. I hope one day. I really think what you're doing is very noble, and it really does deserve a lot more awareness. And I'm glad that we were able to talk about it. I hope this podcast gives a lot more promotion and awareness to the issues that are in Africa and towards Milo Initiative, because it's definitely an issue that needs to be spoken about more and needs to be solved. Honestly, I think way too many Africans are suffering from poverty and a lack of knowing, and it's crazy what simple information can do for people if they just have access to it. If maybe someone like Peter knew about the Milo Initiative, or the parents of Peter knew about it, that could probably have altered the course of his life. So, I hope I hope one day that I wish you continued success and growth in Milo Initiative. And I just want to thank you, Helen, for coming on my platform and speaking your truth and sharing your wisdom with me. I also just want to thank you for inspiring me to jump into freelancing and medical writing. I think when I didn't do it, I didn't know much about it. And I shot you an email and you kindly responded and you took me under your wing. And that really helped me jumpstart myself as a freelancer and even bigger, an entrepreneur. So I just want to thank you for that.
Oh, you're more than welcome. It's my pleasure.
Yeah.
I think there's nothing more than sharing your knowledge, your wisdom, because I believe that nobody's an island.
Yes.
I wasn't born knowing what I know. Somebody gave it to me, or somebody helped me to acquire it.
Mm-hmm.
So there's no reason why I cannot give what was given to me to somebody else. And somebody was generous enough to create opportunities for me. To know what I know and be where I am. And it's the right thing to do, to pass the baton on to somebody else.
Yeah.
Or to as many people as you can.
Yeah. And I hope, and I would like to continue doing the same for the younger generation and just kind of keep having that effect trickle down. That's also the dream of Milo. Yes.
Everybody under the umbrella.
Yeah.
And give them all the resources and all the platform, actually. But with Milo, it's resource intensive. So if anybody's listening and want to support Milo as a nonprofit, they can absolutely reach out to me on LinkedIn, or if you want to share my phone number later, or my email, I'm more than happy for you to do that.
Yeah, for sure. So you guys heard it. If you're ever interested in working from Milo, please contact Helen. And Helen, I just want to thank you for taking the time to speak with me. I wish you the best of luck with Milo, and I'll definitely stay in touch.
Sure. Thank you for your time, and I appreciate being on your platform.
Thank you.